What is type 2 diabetes, and is it possible to reverse it? With 8.5% of the world's population believed to have diabetes, and even more at risk of developing it, a whopping 84 million people who have prediabetes. It does beg the question, can you reverse type 2 diabetes? In this article we shall get to the root of what type 2 diabetes is, before looking into how long does it take to reverse type 2 diabetes. What is type 2 diabetes? Diabetes essentially affects the production, use of insulin within your pancreas. Now, given that insulin controls how glucose from carbohydrates is metabolized and turned into energy for fuel, essential for your skeletal muscles and brain, it is important that we learn how to manage it, so that our bodies are not affected. Type 2 diabetes differs from the other two types because type 2 occurs when your body can produce insulin, unlike type 1 which doesn't produce it correctly and requires injections, but it can't do it effectively, efficiently, due to you being overweight or physically inactive. This means that unlike the others it can be prevented. In fact, 80% of type 2 cases of diabetes can be prevented by simply changing your lifestyle. Do that and you can avoid developing hyperglycemia and the following symptoms of hunger, fatigue, thirst, increased urination, blurry vision, kidney, nerve damage, and skin, mouth, and food infections. Can you reverse type 2 diabetes? Whilst there is no cure, it is definitely possible to prevent and, according to studies, reverse type 2 diabetes. By simply making changes to your diet and trying to lose weight, as well as exercising, can help to eliminate excess fat, which can affect insulin production and how it is used, and enable you to reach, maintain and normalize your blood sugar levels without the need for medication. During one 2011 study, when 11 people with type 2 diabetes reduced their calorie intake for 8 weeks, this helped to reverse their condition. Now, before you jump the gun, we need to reiterate that this doesn't mean you'll be completely cured. Type 2 diabetes is an ongoing disease, so even if you enter remission and no longer need medication, this doesn't mean these symptoms won't ever return. Fall back into bad habits, for instance, and you could start experiencing them again. That being said, by changing your diet to reverse type 2 diabetes, you could potentially go years without having to use medication to help control your glucose levels. Perfect. The science. When you develop type 2 diabetes, the cells that help your body to manage your blood sugar levels stop working correctly. In the past, doctors believed that these cells shut down forever. However, recent research suggests that it is possible for certain cells to come back to life. For instance, when you lose weight, this helps to lower the amount of fat in your liver and pancreas. As a result, this loss of fat can help the beta cells in your pancreas, which releases insulin, to start controlling your blood sugar again. Now, the chances of you rescuing these cells are far more likely the sooner you start to lose weight after diagnosis. So, instead of managing your symptoms with lifestyle changes and medication, it is recommended that you try to lose weight. Note: you should always consult your doctor before you attempt any type of diet to reverse type 2 diabetes. They can help you to determine if your dietary plan is enough to come off of your medication. So what exact steps can be taken to help you reverse diabetes type 2? Let's find out. How to reverse type 2 diabetes naturally. Truthfully, there are many tricks you can try to help you reverse type 2 diabetes safely. Yet, the most popular ones are the following. Changing your diet. Eating right can go a long way to helping you manage your blood sugar levels, especially if you bear the following points in mind. Maintain a healthy weight. If you're overweight, losing enough weight to hit the normal BMI range can reduce your risk 7-fold. Going from obese to normal can reduce your risk 20 to 40-fold. Eat whole grains. Foods such as whole wheat bread, brown rice, and oatmeal can all offer your body more fiber, which is slower to digest. This prevents big spikes in glucose and reduces the amount of stress placed on insulin production. Tip: by eating 2 to 3 servings of whole grains a day, you're 30% less likely to develop type 2 diabetes. Skip sugary drinks. These can all cause spikes in glucose and place a strain on insulin production. So skip having sodas, pre-packed fruit juices, and coffees with syrups in and choose sugar-free drinks instead. Just one sugary drink a day can double your chances of developing diabetes. Get fresh and don't consume processed meats. Would you believe that just one serving of bacon a day can double your risk of diabetes? Yet by swapping red and processed meats for nuts, fish, and poultry, you can cut it by up to 35%. Crazy, but good to know. Reduce your calorie intake. Low-calorie diets can have a positive impact on diabetes. In 2 separate studies, participants were given a liquid diet of 625 to 850 calories a day over 2 to 5 months, followed by a less restricted diet aimed at helping them to maintain their weight loss. Following these studies, they found that nearly 50% of participants managed to reverse their diabetes whilst managing to keep their glucose levels close to normal, for 6 months to a year. Similarly, most of the group succeeded in losing 30 pounds or more. Note: this type of dieting is considered extreme, and should only be done under the supervision of a professional, where they can help you to manage your calorie count. In addition, researchers commented on how those who hadn't had diabetes for very long, were more successful at reversing diabetes than those who had had it for a while. This suggests you should begin a weight loss plan as soon as you're diagnosed as having type 2 diabetes. Low-carb diet. The American Diabetes Association strongly recommends keeping to a low-carb eating pattern, although they have not set a standard amount for how many carbs you can have. Usually, a low-carb diet would be tailored to around 45 to 60 grams of carbs per meal and a total of 200 grams per day. The less you have the better. In fact, some doctors feel the ketogenic diet is the best way to shift excess pounds and stabilize your blood sugars. It works by restricting the number of carbs you eat to 50 grams or less per day. In doing so, your body is forced to break down fat for fuel, encouraging greater weight loss and the benefit of stronger glucose control. Note: this particular diet can lead to muscle cramps, bad breath, and loss of energy. Plus, some studies have noted an increase in hepatic insulin resistance, which can cause a deficiency in some essential micronutrients. I hope you like this video. Thanks for watching, and are there any videos, in particular, you would like to see? Please let us know by commenting below.